Hi there, this is Ellen Wong, one of the team members for Team Nightingale. Our chosen nurse therapist was baby Abdellah, and I'm here to present her 21 nursing problems list that she put together as a part of her patient-centered approaches. And we're going to look at these based on a specific scenario application. So as a part of the patient-centered approaches, Abdallah comprised a list of 21 nursing problems. And so these are actually patient-specific problems that a nurse can identify in order to help organize her nursing interventions. So we're going to look at these a little more specifically. So the problems can be divided into 4 levels of needs. So when Abdallah put together these 21 nursing problems, she actually was influenced by Maslow's hierarchy of needs and kind of comprised these problems based on that. So the first of these is level 1, which is basic needs. When Abdallah examined problems, she defined problems as being either covert or overt. So covert problems are hidden problems. So these are things that take different ways of actually exposing them. And overt or obvious problems that can be seen up front. So basic needs are common to all patients. So these are similar to Maslow's hierarchy of needs of just human necessities. So they can be identified by both direct and indirect methods. So the basic needs that Abdallah identified were in her first 4 statements. So these include good hygiene and physical comfort, promoting optimal activity, which include exercise, rest, and sleep, and to promote safety through the prevention of accidents, injuries, and other traumas. And also helping the patient to maintain good body mechanics and prevent and correct deformities. The second level is called sustenance needs. These are usually considered overt problems, and they're focused around problems based on physiological body processes. So these are obvious things that we can see through assessments and looking at the patient. And so they're identified through direct approaches. Abdallah identified these as statements 5 through 11 of her 21 problems. So these include maintaining supply of oxygen to body cells. A lot of it is focused around maintenance. So maintenance of nutrition, elimination, fluid and electrolyte, recognizing the physiological responses of the body to a disease condition. And these responses can come as pathological, physiological, or compensatory. So to facilitate the maintenance of regulatory mechanisms, so reflexes, vital signs, to facilitate the maintenance of sensory function. So these would be the patient's vision, hearing, tactile senses. The third level is the remedial needs. These are usually covert, so they're hidden. So these are something that are internal to the patient. And they are problems that are usually related to emotional and interpersonal difficulties. So as we get a little higher up in the needs, these become more, they don't manifest themselves physically. So these are identified through indirect approaches. So remedial needs are the problems 12 through 18 on the list. And these include identifying and helping the patient to accept positive and negative expressions, feelings, and reactions, identifying and accepting interrelatedness of their emotions related to their organic illness. So a patient who has a heart attack may feel a sense of depression, and they are linked. So facilitate the maintenance of effective verbal and nonverbal communication, helping them develop productive interpersonal relationships, facilitate progress towards achievement of personal spiritual goals, and then to help it create and maintain a therapeutic environment for the patient. And the last one is to facilitate self-awareness of the individual with varying physical, emotional, and developmental needs. So looking at the patient in a holistic sense, how old they are and how that can contribute to their awareness. And the last is restorative needs. These can be manifested as overt or covert, and they're related to almost environmental factors, so sociological or community problems, so things that influence the situation. Identified through direct and indirect approach. And these are Abdellah's last three, number 19 through 21 of the statements. So to accept the optimum possible goals in light of the limitation, utilization of community resources as an aid to resolving problems, and to understand the role of the social problem as influencing factors in the case of illness. So this is all the levels of needs overall. And so the purpose of this presentation is actually to apply these 21 nursing problems in a specific scenario. So I am actually a nursing educator, and one of the units that I cover is rehabilitation. I was once also a medical surgical nurse on an acute care floor. So I decided to apply the 21 nursing problems as they relate to daily practices on a rehab unit. At this point, I'm going to stop speaking and let this actually transition to music so you guys can kind of go through this scenario and read the context of it. So I hope you enjoy it, and thank you very much for watching this.